Welcome to Weber Gallagher University, Weber Gallagher's series of educational programs. This is our workers' compensation webinar series. My name is Paul Fires, and I'm presenting today with my partners, Jennifer Laver on my left, Stephen Pateko on my immediate right, and Jeffrey Lockyer on my far right. If you would like to view this webinar again, share it with others, or see our other Weber Gallagher University programs, please visit the Weber Gallagher website, www.wglaw.com. and you'll find a copy of this presentation and others under the Weber Gallagher University page. Also, feel free to contact the firm with any questions at questions@wglaw.com. That's questions@wglaw.com. So today's presentation is coronavirus and workers' compensation, and let's get started. Today we'll be discussing the coronavirus, which is a catch-all phrase for a certain type of viruses that affect human beings. This particular virus that everyone is discussing is known as Covid-19 for its specific strain. Primarily, we're here to discuss the impact that the virus will have in the workplace, to include the fear of the virus, the psychiatric consequences of either exposure or the disease, testing for the virus, and employees who come down with the virus itself. Also, we'll be discussing employees who have to be quarantined due to the virus, and all in the context of what is, and more importantly, what is not, a work-related situation in the state of Pennsylvania, the state of New Jersey, and the state of Delaware. Now, I think that by now most everyone understands that this virus originated in the People's Republic of China, more specifically in the city of Wuhan, and that the virus most likely made the jump from animals to humans via a Wuhan-based food market that sold wild animals for human consumption. The virus is highly contagious, primarily by way of water droplets released from humans via sneezing or other methods, and then the water droplets passing from human to human through the mouth, the nose, or the eyes. While the virus can live on ordinary surfaces for up to a week or more, simply touching the surface with your hand will not give you COVID-19 as we understand the situation today. But if your infected hand goes on to touch your mouth, your nose, or your eyes, or theoretically someone else's, then the possibility of becoming infected with COVID-19 exists. Again, this is based on what we know today, and I'm sure you all realize that there are a lot of studies being done by the Centers for Disease Control and other federal agencies to make sure that we have the best possible protection for the United States and its citizens. Let's start with you, Steve. Your specialty is Pennsylvania workers' compensation law. People are always passing germs or viruses to each other at the workplace, whether from the common cold or influenza or other pathogens. And frankly, I think that's mostly what keeps us healthy, because it builds up our antibodies. It's not necessarily an injury as I see it. And yet we don't see a lot of cases that stem from an allegation of a viral injury. So generally speaking, do Pennsylvania employers have something to worry about with COVID-19?
Well, the answer is possibly. And we will provide a little background on disease treatment under workers' compensation to get to the specifics of this particular strain. Diseases as well as physical injuries can be compensated under Pennsylvania's workers' compensation law. We have provisions called the Occupational Disease Provisions, and that lists specifically enumerated diseases that have been associated with particular work settings: black lung disease, hepatitis, asbestosis. The law has has recognized the causal link. And if you have such an enumerated disease, you get the benefit of a presumption that's rebuttable, but the presumption of causal connection, eliminating a very difficult burden of proof in many cases. Those diseases that are not specifically enumerated can also be compensable under a catch-all provision, which requires the employee to establish that that particular disease is much greater incidence of that disease in a particular industry, substantially greater than in the background population. If an employee can do that, they again gain the benefit of the rebuttable presumption. These are the two traditional methods of establishing an occupational disease. Without either of those, you do not get the benefit of a rebuttable presumption, So you have to actually establish the causal link through direct proof. We'll call it the standard burden of proof in Pennsylvania, which in a disease case is very difficult to meet because a disease of general communicability, viruses, colds, things like that, it's very difficult to establish where the particular disease was acquired. Could be workplace exposure, could be at home, could be elsewhere. There are cases that recognize the possibility of establishing that through the tracing of an individual agent, individual transmission, but they're very fact specific and very difficult to meet that standard of proof. So in Pennsylvania, because COVID-19 is not an enumerated disease, and it is, at least at this stage, way too early to tell whether it will be established as, under the catch-all provisions, as substantially greater in any particular industry than in the background population, the employers are going to be left with the standard burden of proof, which is, again, very difficult to meet due to the inability to establish that causal link. Now, it's not to say it can't be done. There may be
How is it in New Jersey?
I think at this point, it's still very difficult for an employee to be able to prove that link. In New Jersey, communicable diseases such as the flu, that's not something that would be covered under workers' comp in New Jersey. You would evaluate it under an occupational medical standard, and the question is whether it's more probable than not that that condition arose during the course of employment. So it's, did it arise out of work? And it's really difficult for an employee to be able to prove that they had this happen at work compared to anywhere else, especially the fact that the condition lays dormant for a period of time. There are exceptions under NJSA 3415-31.5. Public safety workers would be an exception. So where everyone else would be more probable than not, they have a presumption of compensability. So for that type of category, it would be easier for them to be able to prove that that work link existed and that the condition arose out of work. If an employee could prove that the condition arose out of the course of their employment, then you would have to go through that risk analysis and whether or not they could prove whether or not it arose out of in the course of the employment. But I think that in this instance for New Jersey, similar to what Steve said, that it's really going to be difficult for an employee to prove that connection. For occupational for New Jersey, when you're looking at whether or not they could contract COVID-19 directly from the workplace, you have that burden to prove that it's really difficult in this instance. Now, there is an exception, as we said, with the public safety workers, but we also do have some guidance. There is a Lyme disease case, and in those types of situations, when you're evaluating those cases, you can sometimes see what the court feels for these types of conditions. We haven't seen any type of influenza cases, but that would be the most likely scenario that you could evaluate it under and the standard. So looking at those types of cases, just in certain situations, it may be more probable that an employee could actually prove it besides that public safety worker exception.
Thanks, Jen. Jeff, how about in Delaware?
Thanks, Paul. I think in general, there's going to be a fairly small percentage of employees in Delaware that are going to have a chance of making the case for a compensable claim. That first off goes to exposure that we've talked about. It's very difficult to prove that your exposure occurred at the workplace as opposed to anywhere else. Assuming the employee could do that, they then need to prove that the exposure caused the ailment. So one of the things that makes that difficult is that you have to prove essentially that there's something unique about your employment that puts you at a greater risk to contracting the virus than an average person that goes to work, say, in an office. So depending on your particular type of employment, there's either a very small chance that you can prove that, or we'll get into some of the specific positions that could put you at risk to show you have a unique type of job that puts you at risk. My main concern, if there's going to be a multitude of cases, is going to use the aggravation theory. There's a Supreme Court case from the 1960s that says an occupational disease can be an aggravating agent to an underlying condition. So I would liken it this way. If you have a carpal tunnel case, you can either have a doctor say that your job functions, your repetitive job functions led to having carpal tunnel directly, or you could say, I developed carpal tunnel on my own and my job aggravates it, both of which could be compensable. I think the easier case when dealing with the virus, like COVID-19, is to say, I have an underlying condition like heart disease or asthma, and the virus has aggravated that. And I think that's how you get around, in some ways, if you were claimant, the unique aspect of your job component.
Thank you, Jeff. Each of you has in front of you a list of possible jobs where the risk could be greater or maybe different from what is originally suspected. I'd like to share with everybody what those are, and then just have a discussion about which of these jobs you think might require a heightened level of awareness of the risk for COVID-19 transmission in the workplace. Hospital and healthcare workers, manufacturing and plant floors, office cubicle workers, door-to-door delivery drivers, bank tellers and others who must greet the public multiple times a day, janitorial settings, especially those involving bathrooms and trash collection, employees who fly or travel by train or other public means as part of their jobs as differentiated from commuting to and from work from your home, employers whose employees travel include international exposures, employees who work in poorly ventilated areas, and finally, employees who work from home and become infected by an already ill family member. In each of your states, let me know, do you see any kind of heightened risk that employers should be aware of with any of these types of labor forces?
Well, I would certainly see it's heightened risk among healthcare and hospital workers, those caring for those directly infected with the COVID-19 virus are going to have an increased likelihood, I think, of encountering the agent. More so than some of the other jobs, but some of the other employees who travel, particularly international travel to areas where the disease has taken hold and is prevalent, I think there's an increased likelihood there as well, as we see from people who have traveled internationally bringing it back. That seems to be one of the greatest sources of cases. And although you left off this list, Paul, cruise workers, we seem to see a lot of cases on cruise ships these days, and probably due to the confined quarters, it seems to spread rapidly through the cruise ships and result in quarantines. Now, you have passengers, you have employees. The employees on those cruise ships for a much longer period of time. That seems to be another source of increased likelihood of acquisition than some of the others.
Are you worried, Jen, since we have cruise ships leaving out of the state of New Jersey, and I don't want to limit your answer just to cruise ships, but where you have some heightened risk, does that type of job, provided it's a New Jersey employee and it's covered by the New Jersey Act, does that give you some concern?
I think it does. I think it's the question as to going back to whether it's more probable than not. So if they're on a cruise ship, depending upon when they started showing signs, I think that there may be an easier proof element. So I think for New Jersey, evaluating it as not necessarily what they're doing, but whether or not they have an easier time of showing that it's more probable. As I said before, we have the public safety workers that are an exception, but then with a cruise ship or with a healthcare worker where they're coming in contact with a specific individual who tests positive, I think that is an easier proof element than any other of these types of employees. So a manufacturing type employee or a bank teller, those types of jobs, you would have the same risks at home or on your everyday, whereas if you're on a cruise ship and you're in a confined space, or if you're a healthcare worker and you have someone coming in that tests positive, your risk is much more significant. So a lot of these other types of risk factors are similar to if you're out in the general public.
So, Jeff, Delaware is the home to many things, but it's also the home to tax-free shopping, and it's very popular for that. Do you think meeting members of the public, not just from Delaware, but from multiple states who go there to take advantage of tax-free shopping, puts Delaware employers at some additional risk?
Well, I think it maybe puts the employee at risk, but I think as far as a compensable claim being proven, I still think that type of position is going to be very difficult to prove because, for one, you're always at risk of contracting something from working in any office setting, in an office, in someone that deals with the public, et cetera. But I don't think it's going to reach that level that the Supreme Court set forth of a peculiar trait of your industry. So usually those kind of cases are closer along the lines to a mechanic who works with brakes that have asbestos and they develop mesothelioma, something that's a pretty, not most of us work with asbestos on a daily basis. So I think just being around people is not going to be enough to draw your job into there. My main concern would be where you have known contact with people that are infected, like
The healthcare system.
healthcare system.
Gotcha. So real quick, in say 20 seconds or less, what are the tenets for proving an injury in each of your states? We'll start with you, Jeff.
Thank you.
What do you have to show?
Well, first you need to prove exposure, and that's going to be difficult to do because of all the things we've talked about, unless you have the type of position where you're known to be working with someone, you're known to be working with materials or products that come from a highly infected region. So that's the first element. Next, you're going to have to prove medical causation. So you're going to have to prove that your exposure came from work and caused your illness. And that gets into what we've talked about with proving that your position is peculiarly sets you up to be at a higher risk for the position, for the virus, excuse me. And finally, the aggravation theory, whether you can prove that some pre-existing problem you have was made significantly worse by virtue of contact with the virus. So to me, that's the biggest concern for the employer, because those are going to be the high-cost cases, people that have some underlying condition, as opposed to someone who's going to have a more milder course of after they contract the
And
virus.
Jen, in New Jersey, how do you prove an injury?
Well, first you have to prove whether the illness arose out of and in the course of the employment. And in New Jersey, that standard, as I had mentioned, is more probable than not. We do obviously have the public safety worker exception, whereas it's a presumption of compensability. But getting that proof level, I don't think it's going to be as easy as one may think. And you can look at it from, as Jeff had mentioned, you have to actually get it. So that's the first step that they would have to do, is show that they tested positive for having COVID-19. And then you go through the step of whether or not it's more probable than not. And if you pass that, then you have to go through the risk analysis and whether it's something that you actually contracted while working at work.
Steve, how about Pennsylvania?
In Pennsylvania, an employee would have to prove through medical expert testimony they acquired the infection from a workplace exposure that was in the scope of employment to a reasonable degree of medical certainty. Now that is difficult in a widely communicable disease, and a necessary part of that burden of proof would be to reasonably eliminate other potential causes. Acquisition from family at home, from encountering people in the general workplace. So it's a very difficult burden to meet, in my opinion. And it, again, it must be met with a reasonable degree of medical certainty, somewhat different than the burden Jen and Jeff described.
So we've touched upon a couple things with these answers, and I want to jump right to testing. Who pays? Do you wait for the
Good question.
Well, yeah, but let's
question.
see if we can tackle that. Do you wait for the employee to get an appointment with his or her doctor in 3 weeks and hope that the doctor takes their insurance, or does the employer proactively sponsor testing, whether ordered by health authorities or not? And if so, is it covered?
Well, does the employee know that the employee wants the testing? That's the first question. Unless the employee comes to the employer and asks for it, the employer may not know that there's a potential issue. And would an employer be within the rights to require generalized testing without some specific trigger like that? All good questions, but I think an employer would not necessarily be able to turn that cost over to a workers' compensation carrier. Carriers pay under the law for injuries and diseases that have been acquired, actually occur. The testing, however wisely considered a policy, is something that is not necessarily compensable under the comp system, but it may be something an employer would want to do to protect the workforce, number one, avoid the spread of disease, and as a benefit to their employees.
What's your take in Delaware, Jeff?
My take is that really you don't have a compensable injury. So if you're looking at it from strictly a workers' comp standpoint, until you have an injury, you don't have an obligation to pay for treatment. So a diagnostic would not necessarily be something you'd have to pay for under your comp coverage, assuming you could put it through your comp coverage. What I would say is also that if you are trying to process it through your workers' compensation system and you want to pay for it, or you've made a business decision to pay for it without prejudice. Because Delaware, unfortunately, has law that states that paying for medical bills essentially stops you from denying the claim later. So the last thing you want to do is allow someone to have a test, pay for it, and then be on the hook for something that may not be compensable for any variety of reasons. So I don't know that the test itself would be compensable in any situation, really, but if you choose to do so for your own business, means, I would just caution everyone to do it without prejudice.
And how about in New Jersey? Do you have that limitation, Jen?
I think it's the same as what both Steve and Jeff had mentioned, that you want, that it would not be covered under workers' comp. I don't think that the carrier would accept the responsibility of having to pay for the testing because they didn't test positive, so there's no injury or disease as of yet. However, I think that if an employer has a employee come in who ultimately tests positive, you may want to have the rest of your employees have someone come in and have them tested. And that's something that the employer would want to evaluate on an individual basis as to whether or not they feel that that's something that they want to cover. But I think it's a personal choice by each employer. I don't think that there's any obligation because there's no injury yet. If you want to cover it as an employment type situation, you could possibly do that. But with regard to workers' comp, I don't think you have to. And I also think that, as Jeff had mentioned, if you're saying specifically anything about workers' comp, you want to say that you're doing the test and that all of this is without prejudice. Because it's really important that you don't give any presumption that this is an accepted workers' compensation condition.
So there's all kinds of people out there and people bring their life experiences to every situation. But what I've been noticing both in my individual interactions and in the press is there seems to be a growing fear among some people. And fear isn't that far of a relative from a psychiatric claim. So let me ask you about psychiatric claims. Are psychiatric claims something that our clients should be concerned about in New Jersey, Jen? And by that I mean the fear of contracting the virus, the fear of having the virus, the fear of getting tested, the fear of being quarantined, if you're the type of person who carries those kinds of fears.
I don't think it would be covered unless you actually test positive. If you test positive and you can prove that it's work-related, then you, similar to any type of orthopedic condition, would have a psychiatric claim as possibility. The question I think you may have is if an employee has a involuntary quarantine requirement. So you have someone who is traveling and they're quarantined. The fact that they have this testing and then they have the quarantine, that could create a potential workers' comp psychiatric claim. So that's a little bit different because you may never test positive, but that quarantine itself, and if the quarantine is work-related, that may create a claim separate from actually contracting the condition. So it's a possibility.
How about you, Steve? How about Pennsylvania?
In Pennsylvania, psychological conditions can be compensable, but again, the burden of proof is very difficult. This would fall in the category of a mental claim where it's a mental stimulus causing a mental injury potentially. That burden of proof requires the employee to establish an abnormal working condition as the source of the psychological reaction that is objectively established. In other words, it isn't just the employee's perception of what's going on that might be abnormal, but it has to be objectively established by others through other means. And what would be the abnormal working condition? We're not sure under these various scenarios that business travel would be abnormal, quarantine possibly, but there is, again, difficulty in establishing that in itself caused a psychological injury. And it's way too early for any courts to have addressed the issue of what constitutes an abnormal working condition in this setting.
Jeff, how about in Delaware?
Well, on my side of things, I think you're almost at risk of seeing more of these types of claims than actual infections from the virus, because you don't have to necessarily prove you had the virus. You're just afraid of it. Now, as far as it being compensable, Delaware uses a very similar standard to what Steve just referenced in Pennsylvania. And essentially, when you normally take a claimant as they come, if they have a bad back and they make it worse at work, it would be compensable. It's almost the reverse in this situation. It has to be objectively stressful. So really, is it abnormal? It'll be hard to prove that it's an abnormal working condition when everyone in society is dealing with the same threat right now. So that would mean to me that you subjectively are reacting differently than the average person, and therefore that takes it out of compensability. So Delaware in general also is fairly strict about the types of cases they award. There's not many psychiatric injuries from a mental stimulus awarded, and I think these would be cases you could defend pretty successfully, but again, I think you might see a lot of them, so, or at least some.
So Steve, that brings up sort of another topic. We've heard a lot about quarantine, both voluntary and involuntary quarantining. If a business decides to have its workforce be at home, and some of those folks can't work from home because they don't have the ability to work electronically, is that something that can be a covered workers' compensation expense, do you think?
My initial impression is no. Again, without establishing the existence of an injury, even a disease injury, you don't have a compensable situation. That may be, again, a well-advised employer policy in order to prevent the spread of the disease, but the resultant wage loss is not necessarily invoking the compensation statute. There may be other means to compensate that. I'm not sure short-term disability policies would apply because, again, you need a disability. There may be FMLA implications. There may be other means to compensate an employee, unemployment compensation, if they're actually laid off, have wage loss because the employer does not want them in the workplace for good reasons. These are all things that we would need to consult with the employment attorneys about, but I don't see it as a workers' comp situation.
How about you, Jeff? How about in Delaware?
I would actually respond very similar to Steve on that. I think you'd face the same threshold problems of proving the injury, and preventative measures. I'm just not sure that would fall under something that is compensable under the Delaware Act.
Jen, in New Jersey?
I think New Jersey is exactly the same, that because there's been no injury, you're not gonna have the coverage as of yet. So I think it's the exact same answer as you had it for Pennsylvania and Delaware.
If most of us who have insurance policies, whether they're homeowners or otherwise, may have seen, if we've read the policies, an act of God defense. Do either of your states have an act of God defense to protect carriers if in fact an act of God situation is found to exist?
For New Jersey, I don't think that would apply.
Just to explain act of God, that would be something extraordinary like an earthquake or hurricane.
Exactly.
No, we don't have that in Pennsylvania.
Jeff?
No, not written into the act. Again, like you said, maybe the individual policy would have.
Okay. Now, there's common law immunity to a direct suit against an employer, as we all know, and that's really the essence of workers' compensation acts in almost all 50 states. If an employer knew of workplace risk and failed to properly disclose the risk to its workforce, can you get around employer immunity in your state, Jeff?
Absolutely in Delaware, and it's not uncommon to see bad faith lawsuits against workers' compensation carriers or their TPAs. So directly against the employer, you would have to prove very extreme malfeasance, intentional wrongdoing. But as far as the carrier, if the carrier would seem to be going along or taking instructions from the employer or had similar knowledge to the employer who was misrepresenting test findings, for example, you could certainly see exposure for a bad faith claim.
How about New Jersey?
I think similar to what Jeff had indicated, that unless the employer was changing test results, or if they, things like that, I think even if you have a problem with regard to HIPAA protections, with regard to disclosing if a specific employee tested positive, you may need to notify your employees that someone tested positive, but not necessarily identifying. You'd have to follow HIPAA protocols. But I think that it's extremely unlikely for you to be able to pierce that threshold in New Jersey.
Steve?
I don't believe Pennsylvania follows the same bad faith standard that Jeff announced, but that doesn't mean an employee could not bring a direct action against the employer, avoiding the workers' comp immunity. However, the standard would be pretty high, and it's very much like Jen mentioned. You'd have to do something equivalent to an intentional tort, exposing an employee to a known risk, altering test results in a deceptive way that brings about additional harm to the employee. There's some case law that supports that. Would definitely be the exception rather than the rule. We don't see too many of those cases brought.
Steve, let's talk about a situation where a healthcare worker is given specific instructions on how to prevent transmission of the disease in a healthcare setting, but they don't necessarily suit up the way they should, wash their hands the way they should, or follow other preventative measures in direct violation of protocols, or as we call it in Pennsylvania, positive orders laid out by the employer. Does that provide a defense? Should they allege a work-related coronavirus or COVID-19 injury?
Possibly if it takes them, if their activity is somewhat afield of their employment. An employee who just forgets to wear the hard hat one day, forgets to put on the safety glasses. That may be a violation of a policy, but it probably would not constitute a violation of a positive work order defense. Now, if an employee is told, don't do this, such as don't ever ride a forklift, it's not part of your job. He gets on a forklift, drives into a wall and gets hurt. That's a violation of a positive work order because he's doing something beyond what could arguably be part of his job.
Jen, what about New Jersey?
In New Jersey, that wouldn't be a defense. New Jersey that's one of the reasons why the threshold for the workers' comp bar is so high, that an intentional act by an employee still wouldn't render something to not be work-related in most instances. So I think that you still would have the same burden of proving that it was work-related. But at the same point, I think that just because, so if a healthcare worker didn't suit up properly and got infected, it would still be work-related if you were able to prove that more probable than not, it was related.
Jeff, how about in Delaware?
Yeah, they have a defense, willful exposure to an occupational disease. So willful, the spirit of that though really is more than just the proper protocols were not followed to the letter, or they must not have been followed, or you wouldn't have contracted the virus. Just getting a disease or getting a virus or getting exposed to an occupational disease does not mean you didn't necessarily follow protocol to make it non-compensable. When these kind of positive work order cases or things come up, you can't just make a rule that says don't get hurt at work. That's kind of the same thinking here. You can say take all the precautions, wear the mask, wash your hands. People still get infected with it. So I don't think it's a strong defense, but it is a defense.
So this has been a good and spirited discussion, and I'd like to leave our listeners and our viewers with just one more impression from each of you, and very likely we'll be back with another webinar as the situation is very fluid and changing all of the time. Jennifer, do you see a rash of cases being brought in New Jersey?
I do, whether they'll be successful or not. I think that there's a strong defense, but in New Jersey, they'll always file. It's going to happen regardless of whether or not they can prove it.
I see. Steve, how about you?
Frankly, I don't see a rash of cases being brought, and those that are brought would more likely follow that psychological injury path than the physical injury path because it's so difficult to prove. And as time goes on, if this becomes a true pandemic and the disease becomes more and more widespread, that increases the difficulty of a claimant establishing the causal elements necessary. So I don't see it as that much of a problem yet.
Jeff, how about you?
Well, Delaware, as we know, is a small place, and the workers' comp bar is even smaller. So my feeling is if one of these ends up being successful, then yes, you're going to see a bunch. And people will push the envelope at how far they can go to get these things approved by the board. I do think that the employer is in a better position by the way the law is set up to defend these types of claims than maybe some other types of claims. But I would expect to see some, quite honestly, yeah.
And I think for New Jersey, similar to what Steve said, that it's really important that the more prevalent with workers and just the general public becomes, the harder it's for an employee to prove that they get it at work, especially for New Jersey. So if there's only one or two or a dozen cases, it's a lot easier to follow the path. But when it's across the board, it's going to be much more difficult.
I'm going to just add that the disease tends to affect older people more so than younger people, and particularly those in their 70s and 80s that are probably out of the workforce for the most part already. So that's another factor to keep in mind.
Excellent. Well, I want to thank everybody for attending our webinar today, Coronavirus and Workers' Compensation. If you'd like to learn more about this program or others offered by Weber Gallagher, please visit www.wglaw.com/WG-University. Thank you and have a great day.